we are going to go ahead now and treat this smile line right here. She hates these smile lines. I'm actually going to position this Comfortox Vibe down here a little bit, just so we can stay out of our treatment area here. And what we're going to do is we are going to use dermal fillers and solid fillers together in these areas here. And I'm going to use two different purposes for using both of them. For using both of them. The solid filler, I'm going to put a thread right along right in here. I'm going to use a couple of them to give that some support, and then I'm going to come back with the dermal filler, and a little bit differently, I am going to lay down some pillars or struts as we go across there with a very thick and heavy filler here, and that will really do the job to really soften those lines. And then as the PDO threads kick in over time, then that will soften them even more here. So let me go ahead and do this. And now for this, I'm going to go ahead and use this solid filler, and I'm going to put it pretty much right into this downturned corner. It's not really downturned as much as it is the smile line here, and maybe the Marietta line would go down here. This is much more of a smile line, so I'm going to go ahead and really do this. You're going to feel little pinches in here. You're doing great there, Julia. These go in really nice and easy. This side, we only need a couple of these things, so we're going to get these in first, and that's going to immediately give me some structure here along that, so you can see that right there. That's what we're going to do. We're then going to go ahead and take these out. Now, these are going to be it's a double pillar technique. It's the pillars going down this way, and these are going to give me some really good support going down that way. And let me just get that cleaned up, as you can see right there. And now we are going to go ahead and put dermal filler in, cross-hatching it, and a dermal filler pillar going there. But I'm going to use a very, very thick, I really want to use a very, very thick filler here. In this case, we are going to use Juvederm Ultra Plus. Let me just get that cleaned up so we've got a nice clean field, and we're doing that. But what I've done with this Juvederm Ultra Plus is I have placed this in a Comfortox syringe, as you can see. So that is going to give me a much better way to go ahead and come across here, much more precise, much more specific, and I don't have to use too much. You know, with using the regular Juvederm Ultra Plus syringe, I really run the risk of adding too much along here. With this 31 gauge needle, and I of course transferred this with using sterile technique, as we've shown you. The AAFE has got some videos on how to do this. This is really going to be very precise as to where I'm going to go ahead and place this here. And I'm going to use the AAFE injection perfection, the safe injection perfection technique, where we go ahead and place it. We are going to go ahead and aspirate, and then we are going to head and deliver right here. And we're doing this crosshatched into that smile line. And this is going to be much more precise. It's also going to be much less filler than what I'd normally get from a regular syringe. One other trick to what I'm doing here, and look at that. You look how much lighter that's gotten already with this double pillar technique. For that, one other idea about here is I am going, and I know this is not what we usually train on. This is why this is a little bit more of an advanced technique. I am going a little bit more superficial. Typically, when you think of these deeper fillers, you are thinking of placing them deeper because that's really the dermal plane in which they belong. But with this, I need it more superficial because I need more support with this dermal filler, the thicker dermal filler. So you can see how superficial I am. If I tent it up, I'm going to go ahead and aspirate, and I'm going to go ahead and deliver here. So that is what we are doing for this, and that is actually looking fantastic here on this side. And you can see now over time this is just going to get better and better, as you know, as any of you have done PDO threads. So that is using fillers. Now what I'm using for fillers is the solid filler and the PDO filler, solid filler PDO threads and the dermal filler both at the same time. Open for me just a little bit, and I'm going to go ahead and just smooth this out just gently. I don't need to do very much to smooth that out, and then this is going to settle in, and that's going to look better. It already looks better right now, and that's going to get better over time there too. Now let's go to the other side. You guys can tell. Now we are going to go ahead and do this smile line over here using the double pillar technique, an advanced technique with the AAFE, using two kinds of fillers. One is the solid filler smooth PDO threads and by a new bio, and the other one is going to be with going crosshatch and placing fillers with a regular dermal filler, a heavy duty dermal filler. You're going to feel a little pinch right there. I'm going to go right up in this smile line. I'm actually going to go across that oral commissure because this smile line is a little bit different than what she had on the other side here. And go ahead and place one more of these. And this is a quick technique, but you've really got to know what you're doing here in terms of really giving the support right here. So give these a 360 twist, and you've got to be in the right plane, the subdermal plane. You got to get trained by the AAFE on these things. And now you can see those are placed, and that actually did really, really well. Now we're going to go cross-hatch and place a pillar. So now and the reason we call this the double pillar technique is there's a pillar here. Now we're going cross-hatch to really support that smile line, because that's really what it needs. It needs that support. Let me just dab this here just a little bit. And we've transferred, we're using sterile technique into a ComfortDoc syringe, and this is Juvederm Ultra Plus here, and I'm going to fill up this up going this way now. So I've got a pillar going this way or struts going this way, and I've got some going this way, and that is going to work out very well for her. Let me just clean this off just a little bit. And here we go. We're just going to go straight across here. And again, what I'm doing here is look how superficial I am. Usually when you're using a dermal filler like this, like Juvederm Ultra Plus, which is a heavier filler, you're going to go deeper. Here I'm going superficial. I'm going to aspirate. I'm just going to wipe that up. And I'm going to aspirate using the safe injection perfection technique. And I'm going to deliver some dermal filler in this as I go ahead and do a retrograde injection right there, as you can see. And I'm just going to put down a few different pillars right next to it. Aspirate. Go ahead and place this really nicely, and that's going to really give it some support here. And place the next one. Retrograde injections, all the things that we do for this great, safe injections here, which is retrograde injections, just a little bit of filler at any one time here. And we're going to just keep going a little bit more. Aspirate. And know your anatomy, know exactly what you're trying to accomplish here. And I'm just going to go a little bit across here a little bit more. And again, the difference is this is much more superficial. And this has been called various other techniques along the line here. But what we're doing really, we're really one of the only ones that are using both dermal fillers and solid fillers to get these kinds of results here. So you got to know your materials. You've got to know your anatomy. You've got to know proper injection technique, and that's how you will get the best results going on here. So let me just clean her up. That is looking just great. And then we will take a look at her, and that is it pretty much for our technique right now. Turn me up this way here. You can take, this is the ComfortDoc Vibe, as many of you know. You can get that from statdds.com. You can take that away just so we can see what is going on here. So we've softened that immediately, which is what we want to accomplish. That'll actually get better in the next couple of days once the dermal filler sets in, and get better and better once those PDO threads start to produce some collagen. Open for me there just a little bit, and let me just smooth this. Very gentle massage. You don't want a lot of massage. A lot of heavy massage is going to give a lot of heavy bruising, but that feels really good and smooth over there. Let's do the same over here. And that is it for her. How'd you do, Julia?
Good.
Okay, you did just great. We'll get you all cleaned up, and then we'll see how this looks in a couple of days.